So we have met the Honorable Health Minister today regarding certain issues which is regarding the health department. We have raised certain issues which are important to the health sector. Of course, we are happy as a state to see or to experience. We have seen some reports carried out by some newspapers to say that Meghalaya is one of the the state that have allocated more funds to the health department than compared to other states in the country. It has rose from 300 crores in 2010 to 1700 crores in 2023. So we are proud of that, but at the end of the day, we have to see also whether that funds that have been allocated to the health department are being used in a way that our health centers, our PHCs, our CHCs or civil hospitals are able to give that service that the people aspire from these health centers. One of the issues that we have faced with the health department, with the health minister, is that as per government norms, in each CHCs there should be 4 medical and health officer in addition to other specialists. In each PHCs there should be 2 medical and health officer. But as per RTI reply that we have received from the DHS, from the Directorate of Health Services, we have found that there are a lot of vacant posts in these government institutions or in these health centers, be it the CHCs, be it the PHCs. There are around 30 to 37 or 30 to 40 posts of medical and health officer that are still vacant. Specialists also are in the same number. The staff nurses, the lab technicians, the paramedical staff or the ministerial staff, there are hundreds of posts that are left vacant. So we have requested the health minister that steps should be taken in order to fill up all these vacant posts or the sanctioned posts, and she has assured us that steps are being taken in the meantime. Is in the process of filling up these posts, these various posts in the health department in the states of Meghalaya. The second issue that we have discussed is that time and again we have seen the statement made by the government that there are not a lot of doctors to be recruited or to be appointed in the state. We could not find doctors. That is why we cannot send doctors to CHCs or to the PHCs. But if we see every year, the state government sends students under the state quota to pursue their MBBS course. We have found out, like even last year or this year, there are around 200 students going for medical studies under the state quota. And the state government has to incur a lot of expenses so that these students are able to complete their MBBS course. Between the year, we have just asked them, between the year 2015 to 2020, how many students the state have sent under state quota. We have found out that there are around 356 to 59 students who have completed their course under MBBS. But sadly, out of these 356 or 359, around 96 of them have not reported or joined to the government. Why I'm saying they should report? Because these students, before they go and study in the institute, they have to sign a bond agreement. This bond specifies that those students, after completing the course, they should report to the state government, and they should provide service, a mandatory service of 5 years in rural areas. Now the question is, if they have already signed this bond agreement, then we should not have this problem of lack of doctors in the state. But sadly, these students, after completing the course, they are not joining or they are not reporting to the government, but in fact they go on for further studies, or they go and join other private hospitals or private institutions. So we have asked the government that you should take necessary steps to ensure that these students who have gone and studied under state quota, they should come and fulfill the condition that they have signed in the bond agreement. And if they fail to do so, then the bond amount may be 25 lakhs, or it may be 30 lakhs or 35 lakhs. That bond amount should be recovered from them with interest. And we have also given them a suggestion that from the year 2026 onwards, the bond amount should be increased to 1 crore rupees per student for the studies and the MBBS course. So that is point number 2. Number 3 is regarding the dialysis units or centers in the state of Meghalaya. See, we have filed RTI with NEGRIMS, in fact with DHS. We have found out that between the year 2018 to 2024, the number of patients that have been reported to suffer from kidney failure are about 4,000. And this is the data only from NEGRIMS and from Civil Hospital Shillong. Other hospital, they don't, because the private hospital, they are not giving the data to the state government. So we find that for these people, they should do dialysis. Some of them have to do 2 times, 3 times a week or 4 times a week. And the cost of each cycle of dialysis costs around 2,000, 3,000. Only for consumable. We are not taking other variables or other, other for medicine costs and all that, or the transportation cost. So we find that in East Khas Hills or in state of Meghalaya, the dialysis center for Khasi Jaintia and Rivoy is only in Shillong, which is only in civil hospital and in Negrims. So we have made a demand that we have seen the pattern of patients. Most of them are from West Khas Hills, from Giant Hills, from Rivoy. All of them has to come to Shillong, and they have to spend a lot of money for the dialysis treatment. So we have made a demand before the government that the government should at least have dialysis units or centers in each of the civil hospitals that are there in the district. She has informed us that steps are being taken. The dialysis unit will come up in West Khas Hills, in Nongstoin. It will come up in West Giant Hills as well as in East and West. We have told her that as soon as possible, this dialysis unit should be made operational so that patients from the rural areas, they should not have to come and travel to Shillong and spend a lot of money for dialysis treatment. So those were the points that we have discussed with the Health Minister.
See, the ministers, MLAs, bureaucrats, officers all go outside for treatment. Don't you think that this exposes that we don't have facilities, that is why they are running outside?
That is a fact. It is a fact that maybe the health sector, our health, if we compare to the civil hospital Shillong or the other district hospitals, they are not able to provide the services that the people are required. That's why people who have the means, they always travel outside of the state to seek medical treatment. So we have also discussed with her that that's why we're saying we are proud that the state has increased the budget for the health department. But we want that budget, if needed, it should be increased more, but make our hospitals fit, or make our hospital capable of giving the treatment that is required by the people of the state.
This also goes good for equipment, then medicines. We don't have equipment, medicines.
Yeah. That is why we have discussed with her also that as I was saying, the funds allocated for the health department should be increased more, because this is an important sector in the state. As education and health is important to the citizen of the state, so we want the government should take steps that if needed, the funds should be allocated more so that medicines are there, the equipments are there, and the doctors are there in each of the centers or the institutes that are there in the state.